evening, everyone, and thank you for joining. According to the Cancer Treatment Centers of America, 1 of 2 men and 1 of 3 women will be diagnosed with cancer this year. And over 20,000 young adults and children are diagnosed with cancer on a yearly basis. Cancer does not respect gender, ages, beliefs, races, cultures, or status. Anyone can be a victim. There is never a good time to get cancer, but certainly it is a phenomenal time to fight it. After my youngest cousin got diagnosed with cancer, I've done extensive research and I have found many shocking statistics and facts about the disease. I want to show you my little cousin. His name is Carlos Tanguma, and he was declared cancer-free back in June. Today I'm going to be going over how cancer is a problem at both nationwide and at a local level. Discuss why this is the case, and as well I will propose a solution to help solve this issue. Cancer remains a problem in the United States and in the Rio Grande Valley. Many people do not know enough information about the disease. Therefore, I propose that we hold informational sessions at local community centers, colleges, or any other public places so we can educate the community about the signs of cancer, what to do if diagnosed, and how to prevent the disease. Firstly, I would like to talk about how cancer is a problem at a nationwide level and at a local level. According to the National Cancer Centers, an estimated of 1,685,210 new cases of cancer will be diagnosed in the United States. 595,690 people will die from the disease. In 2014, an estimated of 15,790 children and teenagers from ages 0 to 19 were diagnosed with cancer, and 1,960 died from the disease. According to Texas Oncology, more than 38,000 Texans will be diagnosed with cancer this year. And breast cancer is the most commonly diagnosed in women. Texas ranks 2nd in new cases and 3rd in expected cancer deaths due to breast cancer. Luckily for the Rio Grande Valley, we have the latest technology. Treatment has come incredibly far detecting cancer early. As mentioned, these numbers are evidence that shows that cancer is a significant issue, and it is important to understand why and what to do about it. Cancer is a problem at a nationwide level and at a local level because people do not know enough information about the disease. And since we associate cancer with death, untreated cancer commonly causes death. In contrast, cancer treatment often saves lives. Even when it can cure cancer, it helps people live longer. Although cancer affects individuals and patients and their families in different ways, studying its impact on large populations can provide important information that influences our practices, our policies, and programs that directly affect health of millions of people in the United States. The good news is that today is the most exciting time in history in terms of cancer treatment. Options that didn't exist a few months ago certainly didn't exist a few years ago. It is clear that cancer is a significant problem because of the lack of awareness about the subject. Therefore, the solution is desperately needed. The solution as I propose is to hold informational sessions at local community centers, colleges, or any other public places that we can think of where we can inform the local community about the signs of cancer, what to do if diagnosed, and how to prevent the disease. There is no question that in many cases we are cancer phobic. We are more afraid of the disease itself than the medical evidence shows that we need to be. As much as we need to understand cancer itself, we need to recognize and understand the risk of cancer phobia in order to avoid all of what this awful disease can do to us. I've discussed the prominence of both cancer locally and nationally, reviewed how cancer is moving forward, and I presented a potential solution to this outrageous issue. It is apparent that cancer remains a problem because many people do not know enough information about it. Therefore, I propose we hold informational sessions at local community centers, colleges, or any other public places that we can think of so we can inform and educate our local community what to do if diagnosed, how to prevent. If you were to be diagnosed with cancer, how would you react? How would you feel? It would depend on the type of cancer, of course. But the word cancer would make the diagnosis much more frightening. Frightening enough, in fact, to do you as much harm or even more than the disease itself. There is no question that in many cases we are cancer phobic. We are more afraid of the word cancer than the medical evidence shows and says we need to be. We need to understand and recognize the risk of cancer phobia in order to avoid all of what this awful disease can do to us. Thank you.